Hi everyone, my name is Lisa Majeski West and I'm going to be your presenter today. We're going to be talking about a pretty important topic under this new healthcare crisis that we're dealing with in the United States and of course throughout the world, which is the COVID-19 crisis. For those of you who have been attending my webinars, you know that last week I did a webinar on how to do telemedicine for your practices and to bring telemedicine to your patients. Other things that I did a webinar on was on how to deliver durable medical equipment to your patients who may not be able to get to your office but still need help with pain management or rehabilitation. And so what I'm doing now is I'm going to expound a little bit on the DME certification that is needed for Medicare patients so that you can deliver that DME embracing to them. And we're going to also talk about the expansion and the loosening of the provider enrollment rules and regulations that pertain to this COVID-19 crisis. So as we are as the United States is trying to get more providers involved with patients, as the shortages of doctors become more pronounced due to the increase of the healthcare crisis and the need for providers to give services to patients who may not be able to come out of their homes. The federal government has created some tremendous opportunities for us to be able to provide these services to our patients without having to jump through a tremendous amount of red tape. So we're going to talk about this today. The first thing that I do want to tell you, I'm going to switch my slides now, is that I'm going to give you a little bit of a disclaimer. And that disclaimer is that the webinar that I'm giving you today, it's April 1st when I'm recording this webinar. And this contains some information that was provided to me in verbal conversations with representatives from CMS and the National Supplier Clearinghouse on March 30th and 31st of this year. And any verbal data that I get, I always try to verify by asking it again. So if I call somebody and I ask them, all right, how do you do something? And then they give me an answer, I will call again and try to get the same answer at least twice. And I was able to do that with these verbal conversations. So the information, the other thing I did was I checked with other sources who do similar work as myself. And these sources also confirmed that this information was accurate. Now, with that said, this is a very, very fluid situation. So we can only give you information as it pertains to the time that the information was given to us. We are seeing things changing continually every week. There's new data coming out. There are new regulations coming out, or regulations that are being loosened that are being, we're being informed of. And so all I can say is that as data is disclosed to me, I will be presenting it to you in the form of either a webinar, a blog, or an email. And so please make sure that you stay tuned. And remember that the information that you're getting in this webinar is only instructing you for provider enrollment rules during the COVID-19 national healthcare emergency under the 1135 waiver of the Social Security Act. Once this waiver is lifted, these directions will not be relevant. So if you're listening to this, and it's later on in the year, or it's 2021, and the national healthcare emergency has been lifted, then you're going to need to check with myself or with another consultant or with Medicare, with the National Clearinghouse, the Supplier Clearinghouse, on whether these rules still apply. So just want to make sure you're aware of this, that we are doing our very best to provide you data that is relevant and accurate to the time that we're in right now. So let's talk a little bit about the 1135 waiver to bring you up to speed. So due to the COVID-19 national healthcare emergency, what CMS has done is they've loosened a lot of restrictions on medical services. Number one, by expanding telemedicine significantly, and we've done a number of webinars on this already. And if you haven't listened to the telemedicine webinars, you can go to my website, goldstarmedical.net, or you can go to daily.amidoctors.com. And these webinars have been recorded and are ready for you to listen to. So you can get all the information that you need about telemedicine and implementing telemedicine in your practice. The provisions of these waivers are found in Section 1135 of the Social Security Act, and so that's why this is referred to as the 1135 waiver. Now, one other thing that the 1135 waiver has done is that it is offering flexibility with Medicare provider enrollment to support the 2019 novel coronavirus or COVID-19 national emergency. So what that means is that under this 1135 waiver, you as a provider may be eligible for temporary and immediate, and when I say immediate, it can be today, anytime from today to within 7 business days, billing privileges for both Medicare Part B and for durable medical equipment billing. So we're going to talk about both of these elements, Part B enrollment and durable medical equipment enrollment. So let's talk about the Part B enrollment provisions first. Now, these provisions that you see on your screen pertain to Medicare enrollment for Part B physician services. So these would be your telemedicine services, your telemedicine visits, if you are currently not a Medicare provider and you have wanted to enroll in Medicare to be a provider with them, then this pertains to you right now. So for physician and non-physician practitioners would be nurse practitioners, physician assistants, physical therapists, speech therapists, occupational therapists, etc. Acupuncturists are also included in non-physician practitioners. So what CMS has done in order to make the enrollment process go faster is they have established toll-free hotlines so that over the phone you can enroll and receive temporary Medicare billing privileges without having to fill out an application and wait 6 to 12 weeks to get an approval. You can get same-day approval for Medicare Part B. Now, this is not DME. The DME is different, okay? You would get same-day approval for Medicare Part B physician services. Now, what that gives you is something called a PTAN, P-T-A-N, which stands for Provider Transaction Access Number. You would essentially call the toll-free hotline of your Medicare provider, and the following screening requirements are waived: the criminal background checks, the site visits, and all revalidation actions. And so essentially, what you're going to be able to do is you're going to be able to call these numbers and then get your enrollment done over the phone. Now, the second provision is for DME suppliers and medical supply companies. And this is what they are doing is, under this waiver, Medicare is expediting any pending or new applications, all clean web applications, and we'll talk about that here extensively in this webinar, will be processed within 7 business days, and all clean paper applications in 14 business days. And on top of that, Medicare is going to waive the following screening requirements: the application fee, criminal background checks, site visits, and they're going to postpone all revalidation actions. Now, I will talk to you more about these elements as we move through this process. So I get a lot of questions. I'm going to try to answer as many questions as possible in this webinar. So the first one that I get a lot from clients is, how long will the 1135 waiver be in effect? And will my temporary billing privileges as a physician or non-physician practitioner be deactivated once the national emergency is lifted? And that's a great question. So it's like, well, why am I going to do this if after the national emergency is lifted in a few months or whenever it happens, it's going to go back to the way it was? So what Medicare says, and this is directly from the FAQ sheet on provider enrollment waivers, your Medicare billing privileges are being granted on a provisional basis as a result of the public health care emergency declaration and are temporary. Now, what it's saying is that upon lifting of the public health care emergency declaration, you will then be asked to submit a complete enrollment application in order to establish full billing privileges. So you're going to be, I spoke to a really, really nice lady at the National Supplier Clearinghouse. I spoke to another person at one of the Medicare Administrative Contractors, Novitas Solutions, which is the contractor for Texas, which is where I reside. And both of them said that you will have, basically, you'll get a letter from Medicare once the 1135 waiver is lifted. You're going to get a letter. You're going to have 30 days to respond to that letter and initiate or continue with the application process. And if you decide not to, then if you don't respond within 30 days, your billing privileges will be deactivated. So the good news is that once you get this started, then your provisional billing privileges will continue until the application, the formal application process is complete. So that's good. So how do I apply for these Part B privileges? It's really as easy as a phone call. You're going to call your Medicare Administrative Contractor hotline for Part B enrollment in your state. So whatever state you practice in, you're going to call that Medicare Administrative Contractor. And I will have the phone numbers on the screen here in just a few minutes. The agency is urging providers or their administrators to be prepared to supply key details in order to gain immediate clearance, which means like right then over the phone. At a minimum, you should expect to provide your legal name, and and just to let you know, everything needs to match. So if you're enrolling as a group, the legal name is going to be the name that is on your corporate papers, and that needs to match the legal name that is on your EIN for the tax ID, and that also has to match the legal name that is in your NPI registry. So make sure that all of those names match up. If you're enrolling as an individual, it is the legal name as is listed on your Social Security card. So if you've recently been married, or if you use a nickname or whatever, make sure you use your legal name as it appears on your Social Security card, and hopefully that matches up with your driver's license. So, so legal name, your NPI, Social Security number, a valid in-state or out-of-state license to practice medicine, your address, contact information, and so on and so forth. You will also be asked to provide checking account information, because all payments by Medicare are direct deposited. Medicare does not send paper checks out. So you'll need to make sure that you have a bank account. And again, that the name on the bank account matches the legal name that you're going to be billing under. So again, everything needs to line up. So make sure you've done that ahead of time before you do this application. If things aren't matching up, you may want to get that in order first before you call the hotline to get the enrollment done. Missing details can likely lead to a delay. Physician and non-physician practitioners will not be required to pass through the screening requirements. You will be granted a temporary Medicare billing privileges. But if you don't pass these basic screening requirements, then you would not be granted temporary billing privileges, and then you'd have to get your ducks in order, so to speak, to get that billing privilege done. So these are your national hotline numbers. Now, if for some reason you're not sure who your Medicare administrative contractor is, on the next slide, I will have the map, the jurisdiction map, so you will know. And if for some reason you haven't written down, quickly these numbers, I do have handouts available. Feel free to email me. I will have my information up at the end of the presentation. So you can send me an email for a list of these national hotline numbers. There are going to be a number of other slides that you may want more information on, and I will be able to provide you with that information by emailing me for that. So just, be aware of that. So these are your national hotline numbers. This is the number that you would call to get your Medicare Part B billing privileges. Now, do you still need to complete an application? And the answer is yes. If you want to extend your billing privileges beyond the waiver, then it would behoove you to go ahead and, after you've gotten your temporary billing privileges, go ahead and submit an application, because if you do it now, then once the billing privileges or the waiver has been lifted, then it's likely that you will be able to have those privileges extended almost immediately without having to go through a lot of extra hoops or jumping through extra hoops to do that. So the 3 Medicare applications that you would be looking at completing once you get past this temporary billing privileges are going to be the individual application, application for a group practice, and the numbers that you see here, 855I, B, and R, are the numbers of the application. So it's the Medicare form that you would be looking for. So if you're enrolling as an individual, you're going to enroll under the Medicare 855I. If you're enrolling as a group practice, it's the 855B. And if you are an individual physician reassigning benefits over to a group practice, you would also need to fill out the 855R. Now, the good news is that if you're doing the application online, you're going to follow a tutorial or basically an interview, an online interview by Medicare. Medicare is going to guide you to the correct application. These are your AB MAC jurisdictions, AB meaning Medicare Part A, Medicare Part B. So for example, if you practice in Texas, you would call the hotline for Novitas, which would be the 855-247-8428. And so this way, with your handouts, you'll be able to know who your Medicare administrative contractor is that you need to call. You need to make sure you call the right contractor for your state that you practice in. Now, that's how simple it is to get the Part B billing privileges. And you make a phone call, you give them some key pieces of data, and you're going to be granted temporary privileges. You'll also want to follow up with a formal application if you'd like to extend those privileges beyond the 1135 waiver. Now, if you're wanting to get the DME billing privileges, then what you're going to need to do first is you're going to have to determine the type of supplier you're going to be applying under. There are 2 types of applications. They have what's called the accredited application and the non-accredited application. If you are a chiropractor and you are 100% owner of the medical corporation or the chiropractic corporation that you direct, and you do not have any MD ownership in that corporation, then you would have to follow the track to be accredited. This is for medical supply companies, chiropractors. Non-accredited, if you are an MD, DO, PT, ST, OT, and you have at least 5% ownership in your corporation, then you could go the non-accredited track. Now, if you are accredited, what the difference is between accredited and non-accredited is that if you're accredited, you're able to bill and sell DME to the general public in addition to your patients. Essentially, what you're doing is you're setting yourself up as a medical supply company. Now, I always get the question is, why does a chiropractor have to go under the accredited route? And the reason for that is because at this time, chiropractors have very limited scope of practice for Medicare Part B services, meaning the only thing a chiropractor can do under Medicare Part B are spinal manipulations. Because they cannot offer other medical services to patients, they are also not able to offer DME to their patients, which means they have to set themselves up as a separate medical supply company. And it's right or wrong, convoluted, it is what it is. Now, if you know, there is some legislation out there in the House of Representatives looking to expand Medicare privileges to doctors of chiropractic. Who knows? Maybe this COVID crisis will move that along. I don't know. But that is sitting in Congress right now, and you know, we'll see what happens. But for now, as of today, April 1st, you are able to set yourself up as a medical supply company and get your billing privileges that way. Non-accredited is a little bit easier. Essentially what you're doing is you're attesting to the fact that you're only going to bill DME to your patients. And I know that for most of you who are listening, if you're a chiropractor, you're probably only going to be billing DME to your patients as well. It's just the way you have to set up the corporate structure for the DME. Now, non-accredited applications usually take, under normal circumstances, 3 to 6 months to get enrolled as a DME supplier, and there's about a $600 application fee that you have to pay. Accreditation is even longer. It usually takes 6 to 9 months, sometimes even longer than that, depending on the volume of accreditation applications that have come in. And you have to pay the $600 fee and then pay an accrediting organization to do the accreditation for you. That cost can be upwards of $5,000 or more. And so, you know, you may be thinking about this as a chiropractor if you're 100% owned and thinking, you know, I don't know if it would be worth it for me to even get temporary billing privileges. If you listen to the DME Embracing webinar that I did last week, I showed you some reimbursements that you can get from Medicare on DME and braces. So for example, a lumbar sacral orthosis, which would cost you your cost to obtain that supply could be anywhere from $100 to $200. It might be a little bit more. Medicare is going to reimburse $1,200 for that supply. So when you think about how many braces would it take for me to pay that $5,000 cost, you sell 5 braces and you've gotten your money back on the accreditation process. And so it's, even though it seems like a lot of money, it is still kind of a no-brainer to get that DME certification. So what you're going to have to do is you're going to have to decide if you're going to do this. Now, as I said, the process normally takes, for non-accredited applications, 3 to 6 months, 6 to 9 months or longer for accredited applications. But here's what the 1135 waiver has done. Number one is, while this waiver is in effect, all of those enrollment fees are waived. The accreditation process is waived. And the only thing that you would still be required to do is obtain the surety bond requirement. That is not waived. So you have to apply for a minimum $50,000 DME POS surety bond. We'll talk about how to go about doing that. It only takes about 24 hours. to get that surety bond set up. Once you have that, then you can go ahead and submit an application to be a DME supplier. And with the waiver, that 6 to 9 month window is gone. You will be receiving your billing privileges within 7 to 14 business days. So what is going to happen though when the waiver is lifted? If you're going to apply as a DME supplier, as I stated earlier, it will be the same as with Medicare Part B enrollment. So if you receive the provisional billing privileges, Medicare will begin to contact providers to let them know that they need to complete the accreditation or non-accreditation process. So once you get that letter after the waiver is lifted, you're going to have 30 days from the notice to respond. Non-accredited, you'll have to pay that $600 application fee within that 30 days and to allow that background check and the site visit to take place if they decide to do a site visit. If you're accredited, then at that point you'll have to secure your accreditation organization, pay them, and then once they have gone through their process, then you'll have to pay that additional $600 application fee. Now, some accreditation organizations build their fees into the, the $600 application fee is built into the to that service. So that's just something you'll have to look at when you're choosing the application fee. So the question also that I get from some clients is, if I do this, because it takes so long to get this accreditation process done or to do the background checks, will I lose my billing privileges during that period of time, during that accreditation process? According to the representatives that I have spoken to, what they have told me is that as long as you respond to the notification and initiate the rest of the application process within 30 days of notice, you won't lose your billing privileges. So that's good news. You'll be able to continue to bill Medicare for Part B and DME services. Now, if for some reason you lose, your application is denied because you didn't get them the information they need or you didn't go through with the rest of the process, then you're going to have your billing privileges suspended and you would be required to start the application process from scratch, which means now you're waiting another 6 to 9 months or however long it takes to get that DME certification done. Another question that I have gotten a lot is, can I call that hotline to apply for a DME PTAN? And the answer is no. Those hotlines that I gave you earlier in the webinar are only good for Medicare Part B enrollment. You have to fill out you have to fill out an application online or submit an application by paper in order to get to do the DME certification. So what is the best way to get this done? The first thing that I would recommend is that do it online, because if you do the application by paper, there's some danger to that, and we'll talk about that. But online is going to be the easiest way because it is going to walk you through the process, and it will, when you go through that process, if you have errors on the application, it won't let you submit it until those errors are fixed. And you know that once you've submitted your application online, that you're submitting a clean application. And as Medicare says, if a clean web application is submitted, you should get your DME billing privileges within 7 business days. And by the way, what they are telling us is these privileges will be retroactive to the date of the designation of the national healthcare emergency, which is March 1st. So your applications for your DME PTAN and your Part B billing privileges will go be backdated to March 1st of this year. So what's the first thing you need to do? If you don't already have a login through the CMS Identity and Access Management System, you'll do that first. And then once you've gotten that login, then you're going to log into a website called PACUS, and you will fill out your application through them. you can do your Part B application and you can do your DME application through PACUS. So this is a screenshot of the CMS Identity and Access Management System. If you already have a user ID and password, but have forgotten it, you can click on the Forgot Password link or the Retrieve Forgotten User ID link, and it will take you through a little tutorial questionnaire to get those IDs that you need to start your PACUS application. If you've never done this, then you would click on the left side, the link that says Create Account Now. And if you'll notice, what this account gives you access to is PACUS, which is the Medicare Enrollment System, and NPPES, which is the place you go to apply and manage your NPI numbers. So most of you, if you have an NPI number, probably have a login and a password through INA. You may want to, you could try to create an account, but if you give them some information, especially your NPI, it'll ask you for your NPI number. It may tell you that you already have an account, and if that's the case, then you just back out of it and then go through the Retrieve Forgotten User ID link, and then it will take you through that questionnaire. So that's the first step. You've got to get your login and your password established. If you haven't been in there a while, these passwords to the INA are only good for 90 days. So if you haven't been in your NPI registry, or if you have been in PACUS previously but not in 90 days, then you are going to have to change your password. So there's probably going to be a little work to be done to get started on the application process. Now, once you have your login and your password established, then what you're going to do is go to PACUS. And this is what the PACUS homepage looks like. So if you do a search for PACUS and end up anywhere other than here, you're in the wrong place. So this is what it should look like for the home screen. You're going to see, of course, you're only seeing about half of my screen. I did a screenshot on this. There's going to be a user login and a password. And then towards the bottom of the page, you're going to see a link that says My Associates. If you click on that, it will give you a list of all the applications you currently have, applications that are currently in process, and it will give you an option to create a new application. And so this is where you're going to need to go to get started on your application through PACUS. Now, you can submit a paper application, but remember that the processing time is going to take longer. It is easier for CMS to lose the application, and this happens more often than I'd like to see. So I am very, very hesitant to submit paper applications. If you do, make sure when you mail those applications, you mail it with tracking and with delivery confirmation, and keep copies of those applications in case Medicare says that the application is not complete or it's not legible or whatever the case is. This is the link on your screen for you to access all of these applications. And so if you click on this link, you will be able, it will take you to the website, and the website is going to link you over to all of the applicable applications that you need to fill out. And remember, the ones that are going to pertain to you, depending on your situation, are going to be the 855B, the 855I, the 855R, and the 855S, which is the DME application. All the others deal with hospitals, with physician-owned hospitals, diabetes prevention suppliers, and things like that. So, so those would be the applications that you would need, and depending on where you're at in Medicare enrollment, you may have to fill out all of them. You may have to fill out one or two of them. So again, if you do it online, it will let you know which applications need to be filled out. And of course, online, the data can be transferred, the basic data of your practice and your name, and the demographic data can be transferred from one application to the other, which makes it a little bit easier and takes a little less time. But if you don't have the option to do an online application, then you can certainly do a paper application. Now, I want to talk to you a little bit about this online application for DME. One of the things that we have found, and that has actually caused quite a bit of confusion amongst clients, is that the website, PACUS, has not caught up with all of the changes regarding the 1135 waiver. So it may still be asking you questions about getting accredited and submitting application fees and so on and so forth. And then you get confused and think, well, do I have to submit an application fee or don't I? And so a couple of things to be aware of that I'm gonna take you through some screenshots right now, so that you fill it out correctly, so that you are submitting a clean application. One of the things that it is still asking for is the accreditation option. And so if you are a 100% DC-owned practice, you're going to have to choose the accredited option. And you'll see what I'm talking about as I show you these screenshots. You may be even asked to provide an accreditation organization that you're working with. And you may not have one yet, but you can just put one in. From what Medicare has told me and the National Supplier Clearinghouse has told me is put something in there so that the application will go through. They will be reviewing those applications individually and waiving those requirements. So, but when the waiver is lifted, you can then either use the selection that you've made or change that selection, as long as you do that within the 30-day notification window. So one of the first, actually, because I can't get into the DME application unless I have an application to do, I pulled this from the paper application, but the PACUS website is going to have the same exact data. So if you are 100% DC owned, you're going to check the box for medical supply company. If you are 5% or more MD owned, then you're going to check the box for physician. Medical supply company is going to require accreditation. Physician is not. So, and if you're listening to this and you are an occupational therapist or a physical therapist, there are choices for that as well. And so you can apply as a physical therapist to be a DME supplier, and you would go through the non-accredited process. So this comes right off of the CMS 855S application. The accreditation information, if you are a DC, then you would check the box that says the enrolling supplier business location in Section 2A is accredited. MD, you would state, is exempt from accreditation requirements. And under the PACUS application, these data fields, the name of the accrediting organization, the effective date of the current accreditation, are asterisks, meaning that it is a required data field. You can't go any further until you fill that out. So what the National Clearinghouse representatives have told me is that put in an accrediting organization, set the effective date of that accreditation for March 1, which is the date that the waiver was in place. And if you're required to do an expiration date, do March 1 of 2021. Just put some data in there so you can move forward with that application. Okay. According to the reps, again, at the National Supplier Clearinghouse, this information has to be filled in, even though accreditation is waived for those temporary billing privileges. Now, this comes from CMS. These are the organizations that have been given deeming authority by CMS to accredit suppliers. And so the ones that I've highlighted are the ones that are most commonly utilized for physical medicine practices to get DME accreditation. JCO, the Joint Commission, is usually an accreditation organization that accredits hospitals. And so typically their wait times to get accredited are extremely long, a year or more. So you typically will want to go through some type of accreditation like the compliance team. the Accreditation Commission for Healthcare, the HQAA, Healthcare Quality Association on Accreditation, or Community Health Accreditation Program. There are a couple of others, but they're not necessarily going to apply to you. So for example, if you're not a pharmacist wanting to sell DME, you would not use the National Association of Boards of Pharmacy. So my recommendation would be to look at one of these four, and I have a complete list of these organizations with contact information and what they will accredit. So in other words, will they credit orthotics? Will they credit TENS units, et cetera, et cetera? All the ones that are listed will accredit the DME that would typically be sold in a physical medicine practice. So if you want a full list with the contact information, phone numbers, email addresses, so that you can start calling these organizations and finding out what their fees are, and what it would take to get accredited through their organization, then by all means, please email me for a copy of this list. Now, what about the surety bond? One of the things that is not waived under this 1135 waiver is the requirement to get a surety bond. So enrolled suppliers are subject to the bonding requirement, and you are required to obtain and submit a $50,000 bond for each NPI that you are enrolling under as a DME supplier, okay? So if you're enrolling your organization, then you would need the surety bond for the organization. You can use a local bonding company that can provide DME surety bonds, or there are national companies available as well. And so, I just basically yesterday did a Google search on where can I get a DME POS surety bond, and it took me to some national organizations that provide surety bonds. You could type in a Google search for DME POS surety bond and the name of your town, and it will probably give you some local companies to work with. I'm a big fan of buying locally, so if you can support your local economy, you should try to do that. Otherwise, you can look to one of these national organizations to obtain that surety bond. You have it takes about 24 hours to get that surety bond. Just make sure that you get that done before you submit that DME application. So there's another question that I get quite often is, who is my durable medical equipment regional contractor? Who do I submit this application to? So when you go through your application on PACUS or your paper application, you're going to be asked a strange question. It's not going to be where do you practice or where do you have your DME supplies located. Is what states will you be supplying these supplies in, or what states does your patient reside in? And the reason for this is because DME is billed under Place of Service Code 12, which is home. We talked about this in the earlier webinar that I did on DME billing. And so again, if you want to get more information on that, you can listen to that, or you can contact me for more tutorials on how to do DME billing. But basically, you need to think about where you practice and where your patients come from. If you are a border state, for example, you actually may be billing DME to different suppliers, to different Medicare contractors. And so on this 855S application, you want to be sure to indicate all the states in which your patients may reside in order to completely fill out this and accurately fill out this DME, because you may be billing claims out to more than one DME regional contractor. This is what the application looks like, and you can see there are 4 jurisdictions, and you have, for example, in these jurisdictions, and if you look at the jurisdiction map, for example, if you practice in far western Pennsylvania and your patients live over the border in Ohio, then you're going to be billing your Ohio patients DME to CGS. If you're billing out DME to your patients who live in Pennsylvania, you're going to be billing to Noridian. So you can see that depending on where you practice, for example, if you're in Nevada, chances are the majority of your patients, you're just going to be selling to Nevada. But think about this: if you practice in Florida, you probably have a lot of patients who have a permanent residence in New York. And if their permanent residence is in New York, that's where they're listed for Medicare. That's where their driver's license is a New York driver's license. Then you're going to be billing in Florida your DME supplies to Noridian in jurisdiction A. So just be aware of that. It's a little bit different than billing Medicare Part B when you're billing out the DME supplies. So the other question that I get a lot is when you look at the application is there's all of these DME supplies that they're asking me about. Which ones should I sign up for? And so in the application, you're going to be given a list of DME supplies that you can prescribe, and don't just check all of them, because what it does is, especially if you're 100% DC owned, it increases the accreditation process. It makes it a lot more, they have to be a lot more thorough. There are multiple certifications that you would have to get, and so on and so forth. So only choose the supplies that pertain to your specialty. So this is what that looks like. And what I did was I put a little smiley face next to the ones that are common choices for physical medicine practices: canes, crutches, continuous passive motion devices, contracture treatment devices, diabetic shoes and inserts, both prefab and custom, heat and cold applications. If you're doing IV nutrients, parenteral nutrients and parenteral equipment or supplies, seat lift mechanisms. So maybe you have a patient who is, who has a lot of difficulty getting in and out of chairs, because you can't do physical therapy with them, you might want to prescribe a Hoyer lift for them. Get them a chair that will lift them out mechanically out of a chair. Traction equipment, TENS, neuromuscular electrical stimulators, orthoses, of course, your custom fabricated prefab and off the shelf. This is where you do your knee braces, your LSOs, and so on and so forth. Ultraviolet light devices or supplies, and walkers. I would stay away from wheelchairs because there is a whole accreditation process to become a wheelchair supplier and also to become a supplier of power scooters. You probably want to stay away from that. But these would be fairly easy to undergo the accreditation if you're required to as a 100% chiropractic owned practice, and even under the non-accredited, it will probably make it easier. So some of the things that, obviously like enteral nutrients, this would be if you're doing feeding tubes, you don't want to do any of that. So just make sure that you are choosing the supplies that apply to the type of practice that you are going to be doing, and what you would reasonably and realistically be offering to your patients. Okay, so if you need assistance with this Medicare enrollment process, the rest of the PACUS application are things like demographic data. The information that I gave you is information that pertains just to the DME application through PACUS. And of course, there's other information in there that you're going to have to fill out, but most of that is pretty self-explanatory. So we've actually come to the end of our session right now. And if you do want assistance with Medicare enrollment, you need some more advice, or you need guidance, or if you want us to help you complete those applications, we have folks that can help you with that. Give us a call at 866-942-5655, or you can send me an email asking me for those. For example, I can send you the list of the National Supplier Accreditation Organizations. We can get you the DME, or I'm sorry, the Medicare Part B hotlines in a data file as well. Please email me with any questions that you might have. Again, thank you so much for your attendance this evening, and I hope that everybody stays safe, stays healthy, and God bless.